And now, please welcome the Executive Director of the American Public Health Association, Dr. Georges Benjamin.
Well, good afternoon, everyone. I want to welcome you to Chicago, the Windy City, and the city that I was born and raised. You know, the first non-native permanent settler in Chicago was a man of color, and I love to pronounce his name, Jean-Baptiste Point du Sable, who settled at the mouth of the Chicago River in the 1970s. He was one of the early public health marvels of this city, interestingly enough, was when the city re-engineered the Chicago River so that it rolls backwards. Did you know that? And they did that to avoid sewage from flowing into Lake Michigan, at that time the main source of drinking water. As I think about that as a health and all policies approach. You know, the drinking water here is safe to drink, it is fluorinated, and it's tasty. And I got to tell you, this is another example of a policy approach, a population-based approach to health. We have exciting opening and closing sessions for you, as well as an exciting Monday afternoon session with our U.S. Surgeon General Murthy. You know, I want to first acknowledge our sponsors. You see our sponsors there on the slide. I want to also acknowledge my wife, Yvette Benjamin, and my daughter, Stephanie Benjamin, who I believe are there in the audience. Also, if you're new to APHA, please stand up and be recognized. If you're new here, please stand up, and please give these new folks a great round of applause. That also means that you're obligated to work with them, exchange with them, share business cards, and be involved. And everybody here should leave with 7 new business cards and contacts. We also have a robust social media program, a social media lab. And I just want to point out to please join the conversation on a hashtag. That's APHA15, hashtag APHA15. Now, I also want to invite interested participants to join the Gimme 5 dance at 5:30 today near the entrance of the exhibit hall, and that's there behind the Mix and Mingle Lounge. Now, you really need to help us with this. Staff have been practicing all year their wares, and I know that many of you have been practicing with them. So please go to the area and get involved in the Gimme 5 dance. Now, we're also celebrating several anniversaries this year of public health significance. And we have ribbons for these. And lots of us are wearing, we love our ribbons. But you get them in the exhibit hall at APHA Member Services and at many of the information tables around the conference. So here are the first 3 anniversaries. This year we're celebrating the 5th anniversary of the Affordable Care Act and our great win in 2015 in the Supreme Court. We're celebrating the 30th anniversary of the Heckler Report on Black and Minority Health. For those of you who don't know, Tom Malone was a member of HHS who actually chaired that work group. And the 50th anniversary of Medicare and Medicaid, our nation's Medicare single-payer health care system, and Medicaid, our program for all the uninsured and underinsured in our country. Now, recently I've been asked why we should engage and hear from people we don't agree with in all of our positions. And I just wanted to say, I've also been told that by engaging with them, it somehow diminishes us as an association. I want you to know I adamantly disagree with those views, and let me tell you why. A, we're the American Public Health Association, and we've been around since 1872, and we've been the most important voice for public health, not only in our nation, but around the world. Now, I believe that engagement and collaboration are leadership functions, and we should never be afraid to listen to anyone, and absolutely important to engage everyone. We've been doing that for years. We're good at it, and we're the big tent, and we're the big dogs on the stage. And if they want to talk about things that they don't agree with, they need to come here to talk about it with us now, each and every day. It won't hurt us. We're not the other side, and we don't be afraid to do it. The ideologues are afraid to engage. They're afraid to collaborate, and they're afraid to listen to all views. We are better than that. We are not reluctant to engage both those who agree with us and respectfully disagree with those who don't agree with us, and we're going to work hard as hell to change their minds. We have to try if we're going to make progress and achieve our goal to be the healthiest nation in one generation. We are the American Public Health Association. We are about science, but we're also about action, and we're also about your health. And I thank you. Now, I do get a chance to introduce someone right now for which we absolutely agree with. We advocated for his confirmation. Since he's been confirmed, we've listened strongly to the strong message that he's given. And I'd like you to give and this, by the way, is his coming out party here at APHA. So give a warm APHA welcome to my friend and the head of the Commission Corps of the U.S. Public Health Association, Public Health Service, our Surgeon General, Dr. Murthy.